Hello, my friends. I'm Dr. Selena Clarke. I'm a urologist and men's health specialist, and for the past 5 years, I've been helping men understand their bodies in a way most of them were never taught. What I want to talk to you about today is something many men feel shy about, even though it affects confidence, connection, and long term well being. Before we get into the heart of it, take a moment to like the video, subscribe if you're new here, and tell me in the comments where you're watching from. I always love seeing how far this community reaches, whether it's someone tuning in after work in a busy downtown apartment or a man enjoying his retirement in a quiet small town. Now, let's have a conversation that a lot of older men never get the chance to hear. Intimacy does not fade just because the years go by. Attraction doesn't suddenly disappear. And yet, so many men come into my clinic believing their body is slowing down or turning against them. They assume they're too old for passion, or that they should simply accept feeling disconnected from their partner. But this belief is one of the biggest myths in men's health. Most changes you notice in the bedroom aren't caused by age alone. They're shaped by habits that are small, manageable, and completely fixable once you understand them. One of the topics men ask me about more than almost anything else is intimacy involving the natural fluids produced during arousal. It's a subject that feels awkward to bring up, so most men keep their questions to themselves. But here's the truth. When you understand the biology behind those fluids and the emotional impact they carry, intimacy becomes more comfortable, more trusting, and far more satisfying. That's what we're going to explore today. After years of treating men in their 50s, 60s, 70s, and beyond, I've learned something important. When men finally understand how the body works, hormones, nerves, emotions, and all, they stop feeling confused or embarrassed, and they start feeling empowered. They reconnect with their partners in deeper ways, and they regain confidence many thought they lost for good. And that's what I want for you. Let's begin with one of the most common misunderstandings I hear from men. Many believe vaginal fluid is something strange or dirty, something to avoid or feel embarrassed about. But this fluid is actually one of the most brilliantly designed systems in the human body. It comes from different glands that all play a role in making intimacy safe and comfortable. The Bartholin's glands create a smooth, silky lubrication that reduces friction. The tiny glands near the urethra, often called the female prostate, add additional moisture when arousal increases. And the cervix releases protective mucus that keeps the internal environment balanced. These fluids are made mostly of water, along with enzymes, minerals, amino acids, and natural compounds that help prevent irritation and infection. Far from being something to shy away from, they are one of the body's signals that a woman feels safe, connected, and ready for intimacy. Emotionally, the impact is powerful. When a man treats these natural fluids as something unpleasant, it can cause embarrassment or shame for a woman. It makes her feel self-conscious and less relaxed, which in turn makes intimacy harder instead of easier. But when a man responds with acceptance and ease, her body relaxes, trust grows, and the experience becomes more connected for both people. Thinking of these fluids as uncomfortable or embarrassing is a habit, not a truth, and habits can change. Another worry men often share with me, but only privately, is the taste or smell of vaginal fluids. They want to know if something is normal or if something is wrong or if variation means they should be concerned. Here's the biological reality. Variation is normal. Just like no two men smell the same after the gym or taste the same when kissing, women naturally vary too. Diet plays a huge role. Hydration, stress levels, and hormones shift the taste and scent of the fluids. Pineapple, citrus fruits, and drinking plenty of water tend to produce a lighter, fresher profile. Foods like garlic or onions or habits like drinking alcohol or strong coffee can create a stronger edge. Hormonal changes matter as well. Fluids may feel clearer around ovulation or slightly metallic near menstruation. After menopause, moisture levels often decrease and acidity can shift. The key point is this: variation is not a flaw or a sign of poor hygiene. It is simply biology. The only time to be concerned is when there is a sudden, strong, unpleasant change combined with discomfort or irritation. That usually means a common imbalance such as bacterial vaginosis or a yeast infection, both of which are easily treatable. The worst thing a man can do in those situations is criticize or make his partner feel judged. Acceptance is not only more respectful, it's genuinely more arousing for both people. Another topic men hesitate to ask about is safety, especially when it comes to oral intimacy. Many worry but feel too embarrassed to bring it up. So let's address it plainly. For healthy, monogamous couples who have been tested and know each other's status, vaginal fluids are generally safe. They are mostly water, enzymes, protective proteins, and natural acids designed to keep the tissue healthy. In fact, from a biological standpoint, the risk from oral contact with these fluids is usually lower than things we do without thinking, like kissing someone or sharing a water bottle. But safety does matter, and it's important to understand the limits. Fluids can carry sexually transmitted infections, just like semen or blood. Infections such as chlamydia, gonorrhea, herpes, syphilis, trichomonas, and HIV can be passed through intimate contact. The risk increases if one partner has active symptoms or if the receiving partner has cuts, sores, or bleeding in the mouth. That doesn't mean intimacy has to be fearful or restricted. It simply means honesty and regular testing are the foundation of responsible connection. Knowing each other's status, testing together, and using protection in new relationships are simple steps that make intimacy safer and less stressful. One of the biggest mistakes men make is assuming that no symptoms means no risk. Many infections are completely silent in the early stages. The more openly couples communicate, the stronger their trust becomes. Silence, more than anything else, is what creates distance in relationships. I've seen many couples who genuinely care about one another slowly drift apart because they never talk about the changes happening in their bodies. Maybe a woman notices her fluids smell different after menopause. Maybe a man is unsure how to bring up a question about hygiene or wants to understand her comfort level with oral intimacy. Instead of discussing it with kindness, people keep it inside. That silence becomes tension. It creates misunderstanding. It makes one partner feel judged even when no judgment was intended. The truth is that bodies change all the time. Hormones shift, diet affects scent, medications alter moisture levels. Stress impacts everything. When partners don't talk about these changes, the relationship absorbs the pressure. What could be solved in one gentle conversation becomes months or even years of discomfort. Communication doesn't have to be complicated. A simple, calm, respectful tone can turn an awkward topic into a moment of bonding. When you approach these subjects with curiosity instead of criticism, it shows your partner you care about her comfort, not just your own. At the heart of all this is something men often underestimate: the emotional power of acceptance. When a woman feels fully accepted, her body, her scent, her responses, all of it, her nervous system relaxes. That relaxation increases arousal, deepens trust, and often improves natural lubrication. Acceptance is not a poetic idea, it has a real biological effect. Tension and embarrassment restrict blood flow. Trust and comfort open it. Many women carry quiet insecurities about their bodies, often from experiences earlier in life. When a man shows he isn't bothered by natural fluids and even embraces them as part of healthy intimacy, something powerful happens. She feels safe with him, she lets down emotional walls. The connection becomes warmer, deeper, and more playful. Men often think performance is all about physical function, but the truth is that emotional safety is one of the strongest performance enhancers a man can create. When a woman believes she is fully accepted, she responds with more enthusiasm, more openness, and more confidence. It shifts the entire experience. So what should you do with all this knowledge? Start by making health a shared responsibility rather than a private worry. Suggest testing together in a way that feels supportive, not suspicious. Testing twice a year is a healthy standard for sexually active adults. It strengthens trust and removes uncertainty. If you ever notice a change in her scent or taste, approach it with sensitivity. You can suggest showering together, encourage hydration, or recommend a checkup without making her feel embarrassed. These small gestures show partnership, not criticism. And most importantly, practice the mindset of acceptance. Her body is supposed to change. Her fluids are supposed to vary. These differences are not flaws. They are signs of health and responsiveness. When you view her natural responses as something positive, intimacy becomes more relaxed and meaningful. Relationships thrive when partners communicate kindly and treat each other's bodies with respect. Every man who walks into my clinic shares the same worries, the same questions, the same uncertainties. And every couple who learns to talk openly discovers that their intimacy not only survives but grows stronger. Safety doesn't take away romance. It builds the kind of trust that keeps passion alive for decades, not just years. Whether you're in your 60s or your 80s, you can experience deeper connection than you ever imagined. You simply have to let go of old shame, take care of your health, and embrace intimacy with openness instead of fear. As you begin applying these ideas, remember that none of this is about perfection. It's about understanding your partner, understanding yourself, and creating an environment where both of you can feel relaxed and connected. When men approach intimacy with curiosity instead of fear, the entire experience shifts. The body responds differently when the mind feels safe. Confidence grows when you stop viewing your partner's natural responses as something to avoid and start seeing them as part of a shared experience. The goal isn't to analyze every moment of intimacy, but to bring a sense of comfort, warmth, and confidence into it. One of the most empowering shifts men make is embracing the idea that age does not diminish desire. Your body may change, but connection doesn't disappear unless you let it. I've worked with men well into their 70s and 80s who found themselves experiencing deeper intimacy than they did in their 40s, simply because they finally let go of embarrassment. They stopped worrying about whether they were too old or whether their partner would judge them for asking questions about fluids, taste, smell, or comfort. Instead, they learned to approach intimacy as a shared journey, something to explore with honesty and patience. When you do that, the pressure lifts. You stop treating intimacy like a performance and start treating it like communication. That shift alone can transform your confidence.